What's up everyone? So what do all models have in common? In our training as plastic surgeons, we're taught about proportions of the face and what is perceived to be beauty. Now the face is divided into thirds and fifths. So for thirds, it's 1/3, 2/3, 3/3. So that constitutes the thirds of the face, going from top to bottom, or cephalad to caudad in medical terms. And going from left to right or right to left, it's fifths. 1, 2, 3, 4, 5. When the face is in this proportion, it's perceived as having beauty. To give you an example, if someone has, say, a small chin, and you put in a chin implant or filler and you make that distance longer, all of a sudden their face is what's called harmonized. Everything just looks right, it looks better. So that's the theory behind a lot of these surgeries for the face. Now coming to models, just for leisure purposes and also for work purposes, I've analyzed like thousands, millions of faces at this point. And what you do see for models, and this is both for male and female models, but we'll focus on female models because it's more pertinent in that regard. So what the most common thing is that they all have a short philtrum. So this distance from the base of the nose to the top of the lip is on the shorter side. So kind of from 13 to 15 millimeters. When this distance increases, which can be because of aging, when we age, everything loosens in this regard. You become from a cone shape to an inverted cone. With aging, everything kind of descends this way, so this distance increases, or just could be genetic. But if you look at a lot of models, and this is in print and TV, whatever, you'll notice that they have this distance from the nose to the lip is almost always, in fact always, is on the shorter side. So what can you do with this information? Well, a surgery called a lip lift addresses exactly this. And if you follow this channel, you probably know it's one of my most loved surgeries. It's one of my favorite ones to do because of what I was talking about at the start. It can really harmonize the face. So we talked about the thirds, the 1, 2, 3, and if you have that long distance, it increases that and kind of messes up that ratio a little bit, the thirds. So if you do surgery and you fix that distance, all of a sudden you're more in that thirds zone and the face just looks more harmonized and it looks very pretty, very elegant. And that's the big reason why I love doing the surgery, because it's, for a short procedure, it has huge dividends and it really harmonizes the face and makes the face so pretty in a natural, elegant way. So there you have it. Most common things the models have is a short philtral distance. Catch you next time.